ready.
Welcome to another episode of Buff in the Rough. This podcast episode includes a medical disclaimer. The content is for educational and informational purposes only, does not constitute professional medical advice, diagnosis, or treatment, and does not create a doctor-patient relationship. Please consult your veterinary professional for medical advice. I recently spent an afternoon at my local veterinarian's office with my favorite young beagle. It was supposed to be a routine scheduled maintenance visit, and by the time it was all said and done, I'd spent a lot more than I budgeted. That experience reminded me of how much I miss my old country vet that recently retired. Do you ever feel like the cost of taking your hound to the vet is to the point that it's almost unaffordable? You ever wonder what has driven up the prices? Why do things cost so much? Have you ever thought about giving your hounds home care? Today we'll hear from Nicole Myrkle about the state of today's veterinary medicine, its impact on houndsmen, and a lot more. Help me welcome Nicole to the program. Well, hey Nicole, how are you?
Hey, I'm doing great, Mr. Sam. How are you doing today?
I'm doing just fine. I'm really excited to have you back on, and we have an aggressive agenda today. We got a lot to talk about. But I was wondering, maybe for the folks that missed the first time you were on, could you just spend a minute or two telling us a little bit about yourself and maybe what you've been up to since last time we talked to you?
Yeah, sure. So I am the owner and operator of the Canine Transport LLC, and my father, drives for me also. We've just been pretty much the last year very busy transporting dogs. This business has grown exponentially, which we're very blessed for. And that's pretty much what we have been doing. We have gotten into a couple different hobbies lately, like riding side-by-sides. And, of course, we still coon hunt, me and Alan, and, stuff like that. And go to some of the major coon hunts around, like the Winter Classics and the Grand American and stuff like that. So that's pretty much been what we've been up to, just getting everybody their dogs and coon hunting and stuff like that.
Well, it sounds like you're pretty big. So it sounds like Canine Transport's doing really well. You still have those old, I'm guessing they're English red ticks, I think is what you had.
English coonhounds, yes, sir. So
okay.
Some of them are red ticks, some of them are blue ticks,
okay.
And some of them are tricolor, which has, both. That's my favorite.
Okay. Well, could you tell us just a little bit about your educational background?
Sure. So I graduated from veterinary technician school in 2001. I worked in practice for about 6.5 years with one veterinary clinic that had multiple doctors. We did a lot of emergency on-call visits. So I did get a lot of practice with emergency things that happened. And then I did work at the college. I taught at the college I graduated from for a couple of semesters. Pharmacology, we helped in surgery, diseases, and there was an ultrasound class I assisted in, and then of course like radiology and things like that. So basic stuff all the way up to surgery for teaching. And then I did go back into practice I think for another 3 years or so with Albertson Animal Hospital when I moved to North Georgia, and I kind of did that and also transported at the same time. So that started around 2018, I think.
Excellent.
When I started transporting.
Well, this is one of the reasons I wanted to talk to you, is because of your background, educational background, but your experience too. So you have a lot of years in taking care of critters and a lot of hounds. I bet you've seen a lot of hounds over the years. But you're also a part of our world. The listeners that are listening right now, you're part of their world because you also have hounds and are passionate about hunting. So You're someone with the veterinarian education background that we need, but also someone who hunts with hounds. So I couldn't think of someone better to talk to about some of the things that have been on my mind lately. And one is, and I know it's not just on my mind, I know it's on a lot of other people's minds too, but it's the cost. So it seems like everything's getting more expensive. We know that. And inflation happens. We get it. It's rising every year. But on the vet care side, it just seems like there's been this huge jump in in the care we take for our hounds. What are your thoughts on that in general? What do you think's driving overall, just big picture? We'll drill down into some things later, but just big picture. Why is it so expensive now?
So basically, what has happened in the last probably 10 years is you have corporate America that's come into the veterinary field. And, previously, before 10 years ago, you would have a private veterinarian that would own their own practice. Maybe they had a relief vet that worked with them or an associate vet that just came out of school that's learning that worked for them. And then when they retired, they would sell it to the veterinary that worked with them, or they would sell it to another veterinarian, private. But in the last 10 years, corporate America has really taken over buying up private veterinary hospitals, and the reason they're able to do that is because they are offering these veterinarians so much more money for their practices than what a private veterinarian can afford. So it might be like 3 to 5 times more that a corporate office will offer a veterinarian for their practice. And then what happens from there is everything gets restructured. So you're looking at the cost of the practice is a lot more. So right off the top, the corporate office is going to increase prices because they have to make their money back. And then you also have inflation. So some of the stuff is very expensive. Like a lot of the equipment is very expensive for veterinary offices to have, like an x-ray machine, anesthesia machines. Getting those things serviced are very expensive. So while they may not have like an everyday cost of running it, they have to recap that money. So the inflation of instruments going up and different equipment going up, so they have to recap that money. And then pharmaceutical and surgery areas are really the only areas that come into the hospital that there's a margin for profit for them to recap. Like that's their biggest profitable areas. It's going to be surgery and medications. And because everything else is basically labor, they're paying their registered technicians, they're paying their associate veterinarians. Everything else is basically money going out the door. So that's why we're seeing more increase on our side. And then the other thing with corporate America comes different benefits for the employees. So, working in practice may be better for an employee because now they have better vacation time, they have better insurance where that might not have been offered at all before, different things like that. But it costs the client more in the long run also. So, it's kind of like a give and take there. And so we're seeing more of that. What I don't like with the big box stuff that we're seeing is they're very, they have like a list of things that they have to go through with you, and their time frames and things like that they're required to stick to in order for their corporate owners to be satisfied that they're making the most money for the minutes that they're there, if that makes sense. Say your dog comes in for upset stomach, like it has diarrhea. If you had an old school vet, maybe they might just run a fecal, check for intestinal parasites, and if that's what you have, then they stop there and send you home with dewormer, and maybe like something to help with the diarrhea. If it's an outside dog, maybe not, or if they're dehydrated, maybe they'll give you something for that, or inside dog, obviously, because you don't want it to have diarrhea all inside the house. But with the big box veterinarians, you have more of a list of things like, okay, well, we have an upset stomach or we have a diarrhea. They have to ask you all these questions, and then they're going to recommend a list of things. If you're not up to date on everything, they're going to recommend blood work. They might recommend x-rays to make sure there's no foreign body. Some of this stuff isn't always necessary to do on the very first day. Part of that is recommended because obviously they're trying to make money. Also, part of that is recommended because they don't want to get sued. Let's say your dog had diarrhea, but also maybe there was a foreign body, and so you go home and your dog doesn't get any better, and instead of bringing it back because you just spent $200 or $300, you waited out too long and the dog doesn't make it, and now you feel like it was the veterinarian's fault, or whatever, that they didn't. Some people are that way, and I think that at some point there was definitely a level of lawsuits that had gotten higher and veterinarians that had gotten nervous about, missing something and getting sued for it.
This is fascinating to me because I recently, you've just described my most recent vet visit. I just went in for like a vaccination, and I mean, they were trying to sell me 25 different things at once, and I'll get to that in just a second. But to kind of recap, because I feel like we all have seen what you've just described. I lost my own personal little vet. He was 80-something years old when he finally retired, and just his way, his approach was very different. And I felt like we had all the time in the world. If I took a dog in with a problem or an issue or a challenge, I felt like he was totally focused on me and nothing else was in the room with me. With the new veterinarians, I feel there's this pressure. I feel like I've got 10 minutes with them, maybe, and they have to get everything in right there, and then they're out, and then they're on to the next client. I just feel like, the old cattle car, you're just kind of pushing them through. I feel like that's the case. I don't know that that's true or not. But one of the things that I think you just answered for me that I didn't understand or think about was because in my mind, if you have a bigger practice, more doctors, more facilities, a way to spread out the cost more, it should be cheaper. You should have more efficiencies, but I did not think about all the extra things that they have, all the extra different analytical tools or testing that they could have in-house, x-rays, I don't know what all that these guys can have now, and that comes at a cost. So that could be part of what they're paying for. And I also hadn't thought about, and we live in a society that loves to sue each other all the time. So I get that kind of being super aggressive on the front end so they're not being sued later on because they didn't run another test or check something else out.
Right.
So I get that. That makes a lot of sense.
Well, and I think the other thing too is some of these bigger box clinics, if you have your own practice and you're a private veterinarian and you hire a veterinarian to come in and work with you, you are training them one-on-one yourself, the way you want your practice to run and the way you want your clients handled and the way you want cases handled and things like that. When you're dealing with corporate America, they have a list of things that you go through because that is your training also. There's not necessarily, the people who own the clinic are not necessarily there to watch over, to train the new employees that are coming in or the new veterinarians that are coming in. And so they have a list of, what, basically you start with A, B, Z, A, B, C, and you work your way down that list. And it doesn't really, I don't know, sometimes it's effective, but a lot of times you wind up paying for extra stuff that you didn't necessarily need because of that. They don't want to miss anything, which is good sometimes. Sometimes it's unnecessary, and I feel like it's really following a lot more on the human side. Like if you were to go to an urgent care or whatever, these are the things they're going to pull up and recommend automatically. And then as far as the time goes, that is a real thing. Like they do measure that. I worked at a practice. I actually went and consulted a practice that was trying to get better on their wait times. Now they were having a different issue with not being able to get people out fast enough, and so they were looking at trying to rework with them, and change some stuff to help them get more efficient. But there was actually a timer on the screen that showed how long that patient had been in the room before somebody came, how long the doctor looked while they were in there, what their total time was. So that stuff is being tracked. And people's, performance for raises and things, bonuses and stuff like that, that is something that, comes into play. And unfortunately, I don't think it's a good thing necessarily. It's just like when you make a phone call to a bigger company and you have to talk to a robot for 10 minutes before they'll connect you to a real person. And it's just, we've gotten as a society so into hurry up and give it to me now that some of these other things are suffering because that's everybody's mentality too,
I feel like a lot of people are under the impression that today's veterinary experience is centered around money. It feels that way. It seems like it's all about the money. And it's to the point where even when I went last week to my local vet here, all over the front desk, I mean, there's all these pamphlets that are offering services on how you could finance your vet visit. It's gotten so expensive that people have to finance a vet visit now. That just seems like a problem to me.
Yes, and I mean the thing about that is if you're looking at financing just a regular vet visit, like the office visit with your yearly vaccines and something that you should be planning for if you own a pet, and those are the things that you want to be able to do for your pet, that's something that financially you should plan for to be financially responsible. Okay, I feel like if you're going to finance stuff, those companies are great for emergency situations. Like maybe your dog got hit by a car. Obviously, we weren't planning on that happening today. Now we have broken legs. Maybe we're having trouble breathing. We need x-rays. Emergency stuff that costs sometimes hundreds of thousands of dollars. Like $3,000. Well, we probably weren't planning on a vet visit today that was going to cost $3,000. And so it is nice to have some of those things available for people to be able to those moments, because nobody wants to tell somebody while their animal is suffering and pain, we can't work on your animal until we figure out the financial part of it. But back in the day when you had a smaller private veterinary hospital that didn't probably have a whole lot of money backing it, they could only afford to do a couple of those a year where somebody was paying monthly on their thing, and then you're looking at shutting down a veterinary hospital because everybody in their community is on a monthly payment plan or is not paying their bills. And so private veterinarians were getting in trouble like that also financially, being able to float their practices with all the outgoing bills and then the money not coming in on time too. So it's kind of one of those things that's like, it's good to have to keep veterinary practices open, and it's good for the clients to have in emergency situations. But if you're looking at financing a regular office visit, then maybe we're not in a financially good place in our own life to own an animal. And that sometimes is the reality of it. Like, I love animals, but there was definitely times in my life when I couldn't afford to have one and care for it properly, or at least care for it at a veterinarian's office, maybe, because there are some things you can do at home that don't cost as much as going to a vet's office.
Yeah, I get that. I totally get that. I totally understand the big unexpected cost. Versus there's certain costs you just have to expect when you have dogs, but there's going to be things that you have to take care of, deworming, vaccinations, all that good stuff that just comes with good pet care. Yes. But yeah, most people don't budget for a car wreck.
5 years ago, it was probably like $125, $150 for a yearly visit, not including heartworm and flea and tick prevention and stuff, but just an exam, all the vaccines, check the fecal, make sure they don't have any parasites. I feel like $100 and $125 is pretty normal. You might get up to $250 if you're running blood work or, getting 6 months supply of of heartworm and flea and tick medication or something like that. But now it's, it's been a while since I've had to pay for a regular veterinary visit because I do have a lot of friends in the field, thank God. I would dare say it's probably closer to $500.
Yeah, I think that's right, and that kind of leads me into a next just observation I've had. We talked about just different trends that we see and how veterinary medicine and how it's offered today's changed. I feel like when I go to a lot of veterinarians, I feel like I'm going to the car dealership. Like, I've scheduled to take my truck in to have the oil changed, and that's what I expect to pay. And I've budgeted for that. And I expect it. I'm supposed to do it every 6 months or 5,000 miles or whatever it is, whatever the schedule is. And I go in, and next thing you know, they're trying to sell me a set of windshield wipers and a new battery and some new tires. And, oh, yeah, you probably should go ahead, since you use your truck off-road, you probably should change the transmission fluid, even though it doesn't call for it quite yet. And next thing you know, you're out thousands of dollars. And I feel like that's kind of similar, at least my perception is, I can see that in some of these new big box type vets where you go in for, you think, just a vaccination or maybe to do a heartworm test or something, and you're expecting to pay that $250, $300 for just a regular visit. Next thing you know, it's $1,500, $2,000. And I think that's a big problem too, because most people, I feel like they are guilted into to getting their toenails done or to get their ears cleaned or the teeth cleanings or whatever is it, because when you're in there and you're in the heat of the moment with your dog, nobody wants to feel like you're not going to spend money on your dog. You love your dog, you love your hounds, but I think they're guilted into spending a lot more money than they really need to. What do you?
Yes, I think that is definitely. I think the best way to manage that is, have a list of the things that that you need to talk to your veterinarian about so that you get everything covered that you're there for. And then there are things that they're going to upsell. Sometimes things are needed. Like if you have a dog that has fluffy ears and it has a lot of hair growing in its ears, and they recommend getting the ears plucked and flushed, that's to keep your dog from getting chronic ear infections. That's absolutely something, if you're not going to do at home or you don't take your dog to a groomer, that you should have it done, because it's going to save you money in the long run, and it's going to save your animal from getting chronic ear infections throughout the year. But sometimes they recommend it, and they recommend, cleaning the ears out. If there's not an ear infection, then it's not necessary. Now, and those are, I think, a big disconnect in between the clients and the veterinary staff is that sometimes as clients we don't have enough education ourselves on what our animal does need or doesn't need. If you're not going to trim the nails at home, then you should have somebody do it. Does the vet need to do it? Not necessarily. You can have it done at a groomer. You can get the path done, the ears, and the nails, and all of it done for a sometimes lower price, because it's all inclusive, versus going to your vet and having one thing and then another thing and then another thing done. And some veterinarian offices offer bath days and all that stuff is included. So, the other thing you can also do to help manage cost is you can always ask for an estimate. Well, give me an estimate of all the things that you recommend I need to do for my pet, and then let's talk about what is the most important things, like vaccines and getting that heartworm test done and keeping our animal on prevention so that they don't get intestinal parasites and heartworms and fleas and ticks, because we get those also, and we can get nasty diseases from those same parasites. So we want to make sure our animals are protected so they're not, passing it on to us without realizing it. But I think managing your visit yourself with that in mind, of asking for an estimate and going through the most important things based on what your animal needs and seeing what fits in your budget. And that's how I would approach it, and that's how, when I was in practice, I approached it with people who, especially people who were on limited funds or on a budget for that day or whatever. And I feel like if you're at a veterinarian's office and you feel like they're guilting you or making you feel bad because you can't afford certain items for your pet, that you probably should pick a different veterinarian office, because that is a place that is very money driven. And there are some veterinarians out there that are like that. There's some veterinarians out there that are still very just they care very much about their animals and their patients versus just the bottom dollar.
Mm-hmm. I think, Nicole, that's terrific advice, and I think my experience has been even within some of these larger veterinary clinics, you may not jive with one of the doctors. You may not, but there's another one in the practice that you really like. So, an important part of that's finding the right doctor for you, I guess, or for your hounds. But my fear is, and it just smells greedy to me. I'm just going to be honest. It just smells greedy to me, and I hate that guilt thing that they push at different places. Not that they're all like that, but there certainly are some. And my fear is that there's folks out there that'll just avoid going to the vet at all cost. I mean, they're just not going because they're not going to be guilted into it. And so what happens is they use the veterinarian as just if something breaks, catastrophic failure. And that there's hounds out there that are probably not going to get the care that they really need, because some of them do have special needs that do need to go see veterinarians regularly. And so my fear is that kind of setup is just going to perpetuate that choice to not go.
Oh yes, I agree. I do agree with that, and I think that I think one thing is being able to find good resources with good information for some care that you can do at home yourself. I feel like we've really gotten away from that because at one point in time, they were really guilting people into bringing your dog into the vet. Like, you're not a good owner if you don't come to the vet. And now it's like, you're not a good owner if you don't do everything that we recommend for your pet. And it's kind of like, when is enough with that? And the other side of that too, that's frustrating as a houndsman myself, is that there's a lot of veterinarians out there that are not athletic doctors. They don't deal with athletic dogs. And the care for those animals and the signs that we see for our animals in the woods and things like that let us know that something's wrong with our dog a lot sooner than a pet owner notices, because they just have a couch potato that, today Fluffy doesn't want to eat, but Fluffy's been feeling bad for 2 months. You just didn't notice because you don't require anything of that dog. And so I feel like sometimes we feel like it's a waste of money to go to the vet because we get there and they don't understand what we're saying when we say our dog's not training right. Our dog's not running in the woods like he normally does. Like, we're not, there's something wrong with him. Like, it's the same thing as if you have a basketball player and all of a sudden they're not performing on the court anymore. And, obviously our dogs can't say like, oh, well, my knee hurts or my back hurts or I jam my finger or whatever. They can't tell us, whereas a basketball player can tell you. But my point is that our veterinarians are not up to speed. A lot of them are not up to speed when it comes to athletic dogs. And so on top of veterinary care being expensive, now you also have a disconnect between the hunter feels like the veterinarian does not understand or does not even believe them that these are clinical signs that they're seeing of their animal, something's wrong in the woods. And I feel like a major example of that would be like tick disease. Obviously, our dogs are in the woods all the time, and tick disease has gotten so prominent in the last 5 years. And the problems that we see from dogs in the woods, a lot of times they come back positive for a tick disease. Now, if you have a veterinarian that's not looking for that or doesn't know that is a huge part of why animals stop performing in the woods, you may not even run a tick test. You might just run regular blood work and be like, oh, well, there's no infection, or maybe they just have arthritis, or maybe you should switch feed, or, anything like that. But I would say 95% of the time when we have a dog that comes in to our kennel, if it's not performing like it should, we have a tick test done, it's positive for usually Ehrlichia or Lyme's. Ehrlichia is probably the number one.
Yeah.
And then a thyroid blood work, and the thyroid's off, but they're not checking tick diseases, and then they say, oh, well, the dog is hypothyroid. That's why the animal isn't, performing or whatever. But the problem is with that, again, is the thyroid is a filter for the body. So if there's anything else going wrong with the body, the thyroid is going to be off. The thyroid should never be a stopping point of like a place where, okay, well, this is the problem, so we're going to medicate it. No. The thyroid is off. That is an indicator that you should continue to look for whatever the problem is in the body before you just medicate for thyroid. And that's another like disconnect in between regular veterinarians and veterinarians that have worked with athletic dogs. Because if they have a pet that comes in and the thyroid is off, probably they're just going to put it on thyroid medication. And the other problem too is most thyroid screening, most thyroid tests that veterinarians do in the very beginning, it's just a screening test. It's not a definitive. The definitive test is called a T4 by ED, or equilibrium dialysis, and it is more expensive. So sometimes veterinarians will give a client the option, because obviously we're not like in human medicine all the way where they just say, well, we're going to run this test. They still have to ask you because you have to pay for it, and not insurance. But basically, they may give you the option, well, do you want to look further into it, or do you just want to medicate it and see if it gets better? Well, most people are going to say, and I've been guilty of it myself in the past, not for thyroid, but for other things, let's just medicate it and see if it gets better. Well, obviously we're going to give a medication that's going to relieve the symptom. We're not fixing the problem. And, the thyroid is a great example of that. And so then you wind up having somebody who's even more frustrated in a couple months because now they've spent all this money. The problem's still not fixed. We're just putting a Band-Aid on it, but it's bleeding through the Band-Aid, so to speak. And so, those are the kind of things in veterinary medicine that are very frustrating for pet owners, because they've already spent so much money and then the problem still is not resolved.
Well, speaking of ways to cut costs, save money, back in the day, we never would have thought about taking our dogs to the vet like today, and I appreciate you pointing that out. It's changed a lot in how we approach that. But do you have any advice for folks on how to safely administer their own medicines, their own vaccinations, where it's legal and still people can still do that? I mean, do you have any tips or suggestions to share?
Yeah, sure, definitely. So, as far as vaccines go for puppies, this is the regimen that I follow for ours. Most states, for rabies vaccine, it has to be done by a veterinarian. Back in the day, South Carolina allowed you to get your own rabies vaccine and give it. I'm not sure if that's still a thing or not. But most of the time, you're going to have to get at least the rabies vaccine from a veterinarian. But as far as the rest of the stuff goes, like if you're raising puppies, or let's say you got a new puppy, if it were me, from jefferspet.com and have them shipped overnight with the ice pack. I make sure that somebody's home to get those vaccines out of the box immediately and put them in the back of the fridge, not in the door of the fridge, because that gets open soon. And the temperature fluctuates, and that is a huge problem with the efficacy of a vaccine. If you go to Tractor Supply and buy some, and I'm not saying that it's a bad choice, it just wouldn't be my first choice, because you don't know when those vaccines arrived. You don't know if they were cold when they arrived. You don't know if that worker put them in the refrigerator as soon as they arrived. And so if they were left out and got warm, they're not any good. And so that would be my first tip for saving money. Buy your vaccines from a trusted source. Have them shipped overnight with an ice pack. And then put them in the back of your fridge. And you can administer those. And so our vaccine schedule is one vaccine every 3 weeks. I prefer a 4-in-1 or a 5-in-1. And most people call it going to be a DHPP, which is distemper, hepatitis, parvo, and parainfluenza. Sometimes we will vaccinate with leptospirosis. I don't prefer any of the other vaccines. We're going to do an 8-in-1 or 7-in-1, because some of those vaccines that are in those larger ones are not effective, and if you test for that disease later on in life, your pet could come back positive from the vaccine, not necessarily from the disease. So like Lyme disease, we don't vaccinate for that. It's not an effective vaccine, and sometimes your dog will come back positive, and then you have to run a bigger test to find out, is this actually the disease, or is it just showing up in the body from the vaccine? And then you might, if your dog is sick and you're looking for a problem, you might stop there and say, oh, well, we have Lyme disease, and that might not be the case. And then you're treating a problem that doesn't actually exist by a positive. So, understanding what vaccines you're giving is important. And we do it once every 3 weeks, 4 times, and then we do the rabies vaccine, and then it's just once a year for schedule. Deworming is a very important thing also. You can buy most of your dewormer at Tractor Supply, or I like Amazon also because it just ships right to my house. The parental pyomate is a very good dewormer that we start with our puppies, and our schedule is starting at 2 weeks old. So if we're raising a litter at 2 weeks old, we start deworming our puppies every week from 2 weeks old up until 8 weeks old with the parental pyomate, and that is the yellow dewormer. And then at 8 weeks old, we usually give a dewormer for coccidia, which a lot of people are not aware of. And we also change our dewormer to safeguard for 3 days in a row. The reason we do that is to make sure that we've gotten all the hookworms. It also can deworm for whipworms, so we're making sure that we're covered on that end. And then the medication for coccidia, usually we give like Nazaril or Terazeril, but basically coccidia can attack a puppy's system very much similar to parvo, and it can kill them. And it usually happens when a puppy gets stressed out. So if the puppy is on transport, or if it's going to a new home, even if it's not on a transport vehicle, like maybe the new owner just came and picked it up and drove for 4 hours and went straight home. Just the stress from being away from mom and the other litter mates and the change in the environment can be enough for them to have an issue with the coccidia. And so those are things that you can do, like preventative care, that's really going to make a big difference for the healthiness of your puppy in a puppy stage. There are some medications that you can do for flea and tick and heartworm prevention for our adult dogs. Some people do like to use ivermectin for that. We just err on the caution side of caution with using ivermectin as a heartworm prevention. A lot of people do the, I think it's like 0.1 ml per 10 pounds, and you really don't even need that much. I mean, it's effective, but you're kind of giving a little bit over what they need, and so you just be careful when you're doing that because you can wear out their liver and kidneys a little bit earlier, especially if you have an athletic dog that you want to keep healthy and in the woods for a long time. You don't want to wear out their organs faster. We are trying a new topical for the flea and tick stuff because I found that we're seeing some breakthrough on the tick problem with the oral medication. I haven't gotten it in yet, so I don't really want to speak on that quite yet because I don't want to recommend something until I know it's working. But there are some options that you can do that are out there right now, like the Strepsil color is a good one for fleas and ticks. Advantix 2 is good for ticks because it burns the tick's feet, so it keeps them from even attaching. And then, we have ordered our heartworm and flea and tick prevention from Australia for a while to kind of save money there. And some people order it from Canada. The Simparica Trio, now I have seen some research on it that says there's tick breakthrough after 2 or 3 weeks. So if you're going to use that for the other stuff, you should probably look at pairing it with something like Advantix 2 or a different topical product. And then I guess for prevention, that's really preventing parasites is going to be one of the biggest preventions of all the other diseases that you're going to deal with, and feeding a good diet. whatever the best diet that you feel like you can afford, and really research that, because you could feed Diamond, you could feed. I'm trying to think of some of the ones that are in the same price range as what we feed, but you can feed Diamond, you can feed Joy, you could feed Taste of the Wild. There's a lot of them out there that you can feed. Purina Pro Plan for the same price that we feed a Nookshuk, and we prefer a Nookshuk Marine. It's a very clean diet. It's a very dense kibble. It's like 700 calories per cup, which is double what puppy feed is. I've raised Frenchies off of it. They all came out with straight legs. We've raised Dutchies. We've raised Coonhounds on this feed. It's a very good all-in-one feed, and it's fish-based. So if you have animals that have allergies, it's usually very good for them. And the great thing about it is, we feed a third less of what we used to feed. So if we fed a pound of Purina Pro Plan, we're only feeding a third of a pound of a Nookshuk. And you really have to be careful, because you can make your dog fat. Even an athletic dog, you can make them fat on this feed. And so sometimes you kind of feel like you're starving the animal. But if you look at the animal overall and you say, okay, well, the body composition's good, the hair's shiny, we have plenty of energy, our poop looks good, there's no diarrhea, it doesn't smell horrible. I mean, poop stinks, but literally does not smell as bad as some of the other feeds out there. There's just the additives in it. You're going to see a better overall health for your animal. So prevention and a good diet are really big things. And I think that's a great feed to choose if you're not going to feed natural, like you make it at home, or a raw diet. As far as like a fake kibble, that would be my favorite one.
Yeah, I had a guy tell me, and he's a really good breeder, I think one of the best in the Beagle world. He said he could go to a field trial and just walk around and tell you which dogs were on good food just by looking at them, looking at their coat and the shininess and all that. He could just size them up in a minute. And I think there's a lot of truth to that. Well, you mentioned, I want to jump back to, because this is fantastic information. Thank you. You mentioned like ivermectin in milliliters per 10 pounds, but that's liquid. Do people also use the paste?
Yes, people use the horse paste. They use it for safeguard, also for deworming. I don't recommend doing that at all. You can't measure it. You don't know how much your animal's getting. And here's the thing. All of the products are exactly the same. The active ingredient is exactly the same. Whether you get the injectable, you get the paste, or you get tablet form, or you get powder form. Safeguard is a great example of that. So Safeguard is the same thing as Pandicure. It's fenbendazole. It comes in tablet form. It comes in powder packet. It comes in a goat dewormer bottle. It comes in a cattle dewormer bottle, and it comes in a horse paste. The horse paste is mixed with Vaseline. It has the dial on there for pounds for the horse. That's a great product for a horse. If you're dealing with a dog, it's better to just get either the goat dewormer or the cattle dewormer. And the only difference between these two is the size of the bottle. The medication inside of the liquid is exactly the same dosage. So if you have a bunch of dogs, you might want to buy the cattle bottle because it's going to save you money versus buying the little tiny goat bottle. If you only have one dog or two dogs, you might buy the goat bottle because it's only $35 or something like that. It's more affordable for, if you have a smaller pack. But giving the liquid dewormer is a lot better because you can do the calculation and understand how much mils your dog is supposed to get and draw it up with a syringe and give it orally or mix it in with some canned food and they'll eat it right up. And then your dog got exactly the amount that they need instead of just guessing with the paste tube. And the problem with doing that is not necessarily if you're going to make your animal sick or not, but you might not give enough. And if you're not giving enough, now you're causing a resistance in parasites in your animal. You kind of made them sick, but they recovered, and now your animal still has intestinal parasites, but also now those intestinal parasites have resistance to that dewormer. And so it's really important to make sure that you are giving enough without obviously overdosing. Also, and so measuring with the paste is, I don't recommend ever doing that. If that's the only thing you have, then sure, but it would be like bottom of the list for me. And that goes for like if you deworm yourself too, bottom of the list. I would pick a pill or the liquid, preferably over the paste if at all possible.
And I'm sorry, on the liquid, you said you could mix it with just soft food or just shoot it in their mouth. I mean, do you need to mix it with water or anything?
You can just shoot it down their throat. But if you have a lot, like let's say you have a 65-pound dog, for liquid you're going to be giving around 15 mLs once a day for 3 days in a row. And it doesn't have a great flavor. I mean, it's like chalky. So some dogs will like spit it out. They won't swallow it. You might not be able to fight your dog to get it down. So you can get like a can of like Iams patty style, pate style canned dog food. If they really love it, you can mix it in with that. And then a lot of times they just gobble it right up because it just smells like the dog food. And so that was something that we did in practice to get animals to take their dewormer easily instead of having to just cram it down their throat. That makes sense.
It does. One thing that you mentioned, I've got one more question first. Vitamins, supplements, it seems like there's more and more available for dogs, especially these athletic type dogs, to help them with their performance. And I'm a big, just in my own personal life, taking care of me personally, I'm moving more and more towards, or maybe I should say, moving away from a lot of the Western medicine that we have today and really trying to do more holistic, natural ways of taking care of myself. And what do you think about that in the dog world? Are there any veterinarians out there that really try to heal dogs or to treat them more holistically, naturally, rather than give them a pharmaceutical, some kind of drug?
Yes, there are. I had the pleasure of working with a nice holistic doctor, veterinarian, about 10 years ago at one of the practices I worked at. And I'm sure that part of veterinary medicine has continued to grow. And I'm like you. I feel very strongly about pharmaceuticals and holistic medicine and going a natural route if at all possible. Especially in the last probably 5 years, that I've done my own research on things versus what I know and understand from what I was taught in school. And so I definitely would say that that's a good route to start on for maintenance care. It's not always the best as far as emergency care goes, but I would definitely recommend it for everyday supplements and overall health of your animal. And I would just really be careful about supplements that you start your animals on, without researching the ingredients. And just because there's so much misinformation out there, like for example, puppies that have rickets or like crooked legs, I see it online all the time, people recommending, put them on calcium tablets. Calcium. Well, calcium is actually very bad especially for large breed dogs, puppies that are growing rapidly. You want their bones to grow slower so that they can grow straight. And calcium actually does the exact opposite. It makes a bowed leg worse. And so really the best supplement for something like that is going to be cod liver oil and vitamin D3/K2 liquid. And you can order it on Amazon. But anytime you can get either of those in liquid or like a soft cap that has liquid on the inside, that's going to be the most absorbable for the body, and they're going to get the most benefit out of that. And then really look at your life vitamin mixes that they have, like for puppy stage and adult stage, and you look at that. If it has calcium in it, we get problems. And there are other things. Recently had a client in West Virginia that was having issues with his dog, and he had it on a dog food that we wound up switching, I believe, but also had him on a puppy vitamin and a calcium vitamin to help, and it was just getting worse and worse and worse, and so we switched it, and about 2 months later his legs were almost completely straight again. So it's just understanding what you're actually supplementing with. And then another thing is like a misconception in even in human medicine, human vitamins. You have calcium and magnesium. A lot of those vitamins are like calcium and magnesium combination. So it sounds great because you're like, oh, well, I only have to take one vitamin and I get both things in it. The problem with that is calcium and magnesium fight for the same spot in your body. So you're only actually absorbing one. And most of the time, calcium is going to block magnesium, even though magnesium is a more important supplement for you to have. So stuff like that, you really just want to kind of dive deep into whatever it is that you're looking for, and don't just take it at face value of, that sounds great, or a well-marketed thing. If you dig deep enough, you will find the answer for most of that kind of stuff. You just have to, be willing to do the research on it.
Nicole, this has been fascinating. I could talk to you for hours, I think. It's just been a really good educational talk today, and I've certainly enjoyed it and have learned a lot, and I'm hopeful that folks listening have learned a lot as well. Is there anything that I didn't ask you about that I should have, or is there anything else that you want to cover or promote?
No, not anything that I can think of at the moment. I think we covered quite a bit of stuff today, but I will definitely think of some more topics that we can cover at a later date.
That sounds good. Nicole, I really appreciate you taking time out of your very busy schedule to educate us a little bit on the veterinarian side of the business. Thank you so much.
Oh, yes, sir. You're absolutely welcome. Thank you for having me on again.
Thank you for listening to Buff in the Rough. Remember to like and subscribe if you want to be notified when new content is available. And please send comments and suggestions to buffintherough@gmail.com.